Hello, I'm Dr. Maurie Markman from City of Hope. I'd like to discuss briefly a very interesting paper, actually quite topical these days, about large language models as relates to oncology. This was a very interesting paper. I'm sure we're going to see many more of these in the future. It was entitled Performance of Large Language Models on Medical Oncology Examination Questions. This was published in the JAMA Network Open. Very interesting. As we've learned, and the study actually demonstrated these large language models, artificial intelligence, and as it relates to the clinic, are becoming increasingly popular and better. This particular paper looked at several large language models, looking specifically at correct answers to the ASCO self-assessment series, as well as ESMO examination trial questions. And what they demonstrated was that overall, 85% of the questions were answered correctly. By the updated model, the older model was only 61%. So again, they're getting better, 85% correct, clearly within the passing range. However, and this is just a critical point to be made, the researchers noted that yes, 85% of the questions were answered correctly, but 82% of the incorrect answers were rated a medium or high likelihood of moderate to severe harm if acted upon in clinical practice. And these were the words of the authors. So again, they got the questions correct, but in fact, the ones were wrong could have caused serious harm. And if they were used to be acted upon, would they have moved forward? Again, a lot of positive here in the answer to the questions. They get the answer to the questions. But do we really want to employ these things when 10%, 15% are wrong, and they could actually produce harm if they were used in a clinical setting? Much to discuss, much to learn. Clearly, we're going to see many more examples of these models being looked at. But these are test questions. This isn't clinical practice. That's the point to be made. And I thank you for your attention.